Just about everyone you talk to could use a little more sleep. But do you know when you're too tired to drive?
Global statistics show that fatigue is responsible for 30% of the deaths on the world's roads. It may have been the cause of this horrific accident that brought Canada's busiest highway to a halt yesterday. Fortunately, no one was seriously injured when a tractor-trailer collided with another truck on a stretch of the 401 highway in Toronto. But police are looking into whether fatigue played a role in the accident. And earlier today, Natasha spoke to a sleep deprivation expert.
I'm joined by Dr. Colin Shapiro, who's head of the Sleep and Alertness Clinic at the University Health Network in Toronto. Now, it would seem a pretty obvious statement to say people fall asleep at the wheel because they're tired, but is it that simple?
Well, it is that simple in the sense that people who are tired are more at risk of falling asleep, but the reason for their tiredness can vary quite a lot, and there are many different causes of sleepiness and separate causes of fatigue. And it's really important for people who have these problems to try and get them dealt with effectively.
So what's the difference then between sleepiness and fatigue?
It's a million-dollar question which we're still working on. But if I give you this example, if someone runs up a flight of stairs, they might be fatigued. If you're short of sleep the whole night, you're more likely to be sleepy and not necessarily fatigued, although you might be fatigued as well. So there are differences, but both can lead to people feeling that they need to conk out.
And is one more dangerous than another for causing accidents?
I don't think that they're more dangerous than the other, but there are specific situations, and the real danger is when you have more than one problem simultaneously. So people who are short of sleep all week, if they have 2 beers at the beginning of the week, it doesn't have an impact. If they have 2 beers at the end of the week, their sleep debt has accumulated, and now those 2 beers make them really sleepy, and that causes a big problem. So it's the multiple factors that are really a problem.
And just who is most at risk then of falling asleep?
Well, anybody who is either sleep deprived or has an underlying sleep disorder, but there are also certain times of the day that any one individual might be more at risk. So shift workers, for example, are at risk of many things, not only falling asleep while driving, but also in the workplace. And also coming home early in the morning after being up all night, that would be a risk period. But if you do something that you shouldn't be doing before you drive, that might make a problem. So, for example, if you do a lot of exercise and that makes you fatigued, then a couple of hours later you're lulling of sleep, you're driving up to the cottage or whatever it is, that would be a problem. If you've had a big meal just before you set off on the road, that might have an impact, especially if it has tuna or a turkey in it. Yeah, anything with high tryptophan can cause an increase in level in sleepiness. And then also people who are coming off a medication or a substance, such as if you've had a lot of caffeine and then it's withdrawing from your system, that can be a problem. Or medications are often a cause of sleepiness and drowsiness, and that can be a difficulty as well.
I think a lot of people have been in their car and they felt themselves getting sleepy, so
Absolutely.
they pulled the window down, they've turned the radio on. How effective are those things?
They are minimally effective. The real thing to do if you're sleepy is actually to pull to the side of the road and have a sleep. There's nothing like sleep to compensate for sleepiness. But if you do have a sleep, there's strategies. I mentioned one on a program this morning. For example, having a coffee before you have your sleep so that when you wake up, the caffeine has got into your system and you can get going again. Other things like talk radio is much better than listening to music that zones you out, not being overly comfortable. If you're too comfortable, a colleague of mine in Kingston, Helen Driver, points out you're more likely to fall asleep. And there are other situations of boredom that will also lead to it. So a long straight road is obviously going to be worse than a windy road in the countryside.
But are there kind of warning signs you would notice that
absolutely.
you say?
In our research laboratory at the Toronto Western Hospital, we do have driving simulators to test people's level of alertness and performance. And one of the things we notice is that they weave much more. So if you find you're having trouble correcting the steering wheel repeatedly, that's a sign that you're getting sleepy. If your eyelids are sagging, we know this, but people will have their eyelids sagging and they don't register, oh, that means that I'm sleepy, I better do something about it. They really need to do something about it and take action sooner rather than later. A huge number of accidents like the one yesterday that we read about and you hear about a lot of the time are because of people falling asleep at the wheel. It's become more of a problem than alcohol in driving in some ways.
Are there occasions though when you wouldn't have any warning signs and it happens like that and there's nothing you can do?
Very rarely that is described, and that's usually associated with certain medications, and even then it's uncertain, and in some specific sleep disorders that may happen. But those situations are very few and far between.
Okay.
They're very tragic when they do happen though.
Right, so it's the long weekend coming up. What's your top tip then for people watching this who don't want to fall asleep?
The weekend is a time when many accidents occur. You want to be sure that you don't drive at too long a stretch. You don't want to set up at 3 in the morning, because then you've deprived yourself of sleep before you get going. You don't want to have long trips, and you want to take breaks where you're physically active every 2 hours or so. Would certainly be helpful. If people do that, that would help a lot. I'm not so sure that they will.
Okay.
And then the last tip, of course, is get my book on are you fighting fatigue or sleepiness, which will come out this year.
Brilliant. Well, thank you very much for some very good advice there. Thank you very much.
Thanks a lot. Bye.
I've been talking to Dr. Colin Shapiro, who's head of the Sleep and Alertness Clinic at the Toronto Health Network.